I'm seeing a growing number of patients admitted with heart failure where the underlying problem isn't blocked arteries, it's poorly controlled atrial fibrillation. And what's striking is that this has often been developing for a few months. Many of them haven't realised how much they were deteriorating because it happened more gradually. These were typically men and women in their early to mid-70s, sometimes a bit older, sometimes a bit younger. In fact, it feels like a bit of an epidemic at the moment. They come in with worsening breathlessness, fluid retention, swollen ankles, and what looks like new heart failure. But when you take a step back and really listen to the story, it rarely started there. They've often had atrial fibrillation for some time, and it hasn't been well controlled. And then slowly, almost imperceptibly, things begin to change. They notice that there's a bit more breathlessness walking up a hill. They don't quite have the same energy as before. Their exercise tolerance drops. Sometimes they gain a little bit of weight. Sometimes they even have dizziness or a fall because they're fatigued. They're just not coping as well as they used to. And what's important is this decline is gradual. So many people adapt to it. They normalize it until eventually they reach a tipping point, and that's when they present to hospital. Not with AF, but with heart failure. So how does a rhythm problem quietly turn into a failing heart? I often explain this to patients like this. Your heart is like a high-performance engine. It depends on timing, coordination, and efficiency. In normal rhythm, everything is synchronized. The atria contract first, topping up the ventricle, and then the ventricle pumps effectively. In AF, or atrial fibrillation, that coordination is lost. The atria, the top chambers, are no longer contributing efficiently. So you lose that final boost to the filling. But there's a second problem, and this is often the more damaging one. If the heart rate is persistently fast, it's like running that engine at high revs all day, every day. Over time, that constant strain begins to weaken the heart muscle itself. And that's what we call tachycardia-induced cardiomyopathy. So you end up with this combination of less efficient filling and irregular and often rapid rhythm and a heart muscle that is gradually weakening. And that's how atrial fibrillation, if not well controlled, can quietly lead to heart failure. What's important here, though, is that this doesn't happen overnight. It evolves over time, and that gives us an opportunity because in many cases, this process is preventable and sometimes even reversible. Atrial fibrillation is actually very common and becoming more so. Around 2 to 4% of the population has it, and if you live long enough, about 1 in 3 people will develop it. And importantly, atrial fibrillation and heart failure very often go together. If we recognize poorly controlled atrial fibrillation early, if we control the rate or restore the rhythm where appropriate, and if we look at the whole patient and the total picture, then we can protect the heart from progressing to failure. So if you have atrial fibrillation and you've noticed a gradual decline in your energy or more breathlessness, please don't ignore this. That may be your heart telling you that something is changing. And if you're looking after patients with atrial fibrillation, it's worth asking a simple question. Are we just managing the rhythm, or are we actually protecting the heart? Because what I'm seeing more and more is that if we don't intervene early, atrial fibrillation doesn't just stay a rhythm problem, it becomes a heart failure problem.